Today in series of Docplexus KL interviews, we have with us Dr. Mohan Shenoy, who is the Assistant Professor at Sri Gokulam Medical College, Trivandrum. He has done his DM Endocrinology from Amrita Institute of Medical Sciences and Research in Kochi. He is also associated with Indian Thyroid Society and Endocrine Society of India. He has several international publications in peer-reviewed journals. He has his expertise in insulin resistance, pediatric endocrinology, congenital hypothyroidism, and many more. Thank you, sir, for the interview. So let's begin with the first question. So Dr. Mohan, you have authored a paper on metabolic syndrome, insulin resistance, and its association with chronic hepatitis C. Could you please elaborate on the same?
Yeah, thank you for, first of all, Docplexus for involving me in this scientific group. So this topic is a very new one, and the topic focused really on the hepatitis C induced insulin resistance. As you know, hepatitis C is a cause for liver transplantation, and many cases do get rejected because not properly worked up. So we have a lot of case series who were exposed to hepatitis C. We actually selected those patients, gave them a lot of treatment possibilities, and measured their markers for viral as well as metabolic degeneration. And once they were selected, we were able to identify the correct patient, and we were able to give them a proper treatment as well. So this is a new topic, and the research paper is still on the process.
All right. So moving on to the next question. What are the severe neurological symptoms associated with progressive hypoglycemia, and what is the role of counter-regulatory hormones?
Yeah, this is a topic of endocrine research. So unprovoked hypoglycemia or spontaneous hypoglycemia is often missed in clinical practice. The unawareness of the primary physician and the caregiver in the normal setup is one of the factors. So we have to have a lot of seminars and teaching workshops. So the coma and cognitive impairment is more common towards the elderly patients. So once we get through the correct, identify the cause of the patient which is going through, we will be able to target. Counter-regulatory hormones like cortisol, glucagon, they are all happening only once insulin mechanism has failed. So those mechanisms are very interesting, and they have a lot of scope in clinical practice.
Okay. So doctor, my next question would be, what are the developmental challenges that are associated with type 1 diabetes management in pediatrics?
So pediatric age group is a very common age group where we find type 1 diabetes. In India, we have a lot of research possibilities because autoimmune diabetes is often not identified in the common setup. And the child, the family, and the community will benefit by giving proper management on insulin techniques, because as you know, type 1 is a progressive disease which requires insulin. So development of a child starts right from the infancy. So if there is no age group where we can tell type 1 cannot occur, but it's common towards the 10 to 15 years age group. So that patients, we have to get the community involved and give them a lot of motivation to continue insulin therapy.
Okay. On similar grounds, could you please share your experience in handling challenging cases with us? Could be in pediatrics.
We have a lot of cases in our practice. Specifically now in Trivandrum, I am having a center with tertiary care center. I worked in a private medical college with a lot of research happening. So now in my practice, I have encountered drug-induced hypoglycemia. So we have seen a lot of herbal preparations in our day-to-day practice. We have no restrictions on the other indigenous products. So those products are known to trigger, because plants and herbs are known to trigger hypoglycemia by itself. So I came across a 70-year-old man who was taking all these preparations last several years, and he was describing that it was giving him good health. So last few weeks he came with unprovoked hypoglycemias. So I was able to identify that some health nutraceutical agents, I don't take any name, but some agents like alpha lipoic acid, some other drugs are happening. Those drugs really have a role, because if you give extra doses, they don't improve health at all. So once that drug was withheld and many drugs were actually added to that, we were able to successfully give him a proper counseling also.
Thank you so much, doctor. It was a pleasure having you here.
Welcome.
Thank you.